Assalamualaikum viewers, please subscribe the channel, like the video and share. This is the pelvic scan of a 22-year-old lady. She is primary gravid और इसका BPD और HC correspond to 35 to 36 weeks पे. There is no cord around the neck. Fetal cardiac activity is there. Fetal heart rate is 140 per minute. Please see the video, watch the video till the end. You will find a lot of information. Fetal cardiac activity, that is about 140 per minute. AC correspond to 35 to 36 week. Please see or watch the video till the end and you'll come to know the gender of the baby. You see the liquor is adequate. Placenta is posterior, fundal grade 2 to 3 maturity. Femur length correspond to 35 to 36 weeks. Fetal weight is 2.8 kg. Viewer, please like the video, share the video on the social media and please subscribe the channel. And in the comment box, please write down your comments. This is the gender, it's very clear, it's burger sign, so it is the female gender. See the gender, both labias, sign of hamburger sign or burger sign, 3 lines. The gender is very clear. Placenta is posterior, fundal grade 2 to 3 maturity. Cervix is about 3 centimeter. So she is primary gravid, 35 to 36 weeks, 2.4 kg, 2.8 kg body weight, no cord around the neck, and the baby is double X.
Thanks for watching the video. Please like the video and share the video. Thanks.